Michael.
Sorry. Good morning, everybody, and welcome to this webinar on Diabetes Australia Research Strategy 2025 to 2030. My name is Michael. I'm a health economist at Diabetes Australia, and I'll be facilitating this webinar today. A warm welcome to the researchers, Diabetes Australia members, donors joining us today, and a very special welcome to our Killian Victory Medal recipients on the call. I'll start today with an acknowledgement of country. So Diabetes Australia acknowledges Aboriginal and Torres Strait Islander peoples as the traditional owners and custodians of this country. We recognise their connection to land, waters, winds and culture. We pay the utmost respect to them, their cultures and to their elders past and present. We extend that respect to the Aboriginal and Torres Strait Islander people here today. We recognise that Australia is made up of hundreds of different Aboriginal and Torres Strait Islander groups, each with their own histories, culture, language and belief systems. Their relationship with country remains of utmost importance as it is the foundation of culture, family and kinships, songlines and languages. Diabetes Australia is committed to improving health outcomes for all Aboriginal and Torres Strait Islander people affected by diabetes and those at risk. I'm joining you today from Brisbane on the lands of the Turrbal and Juggerah peoples. And for our speakers today, Professor Grant Brinkworth is joining from Gold Coast on Yugambeh country, and Warren Bingham is joining from Sydney on the lands of the Gudurgal peoples of the Eora Nation. I also acknowledge the traditional owners of all the lands our attendees are joining from today. Before I hand over to our speakers and we commence the session, let me briefly introduce myself and share why this strategy matters to me personally. So I was diagnosed with type 1 diabetes 5 years ago at the age of 30. I'd been traveling overseas and became unwell with a flu. And upon coming home, I lost 10 kilograms and experienced extreme fatigue. After some blood tests, my GP sent me straight to the emergency department and I was diagnosed with type 1 diabetes. After this, I received a crash course in how to manage diabetes while adjusting to the shock of receiving a diagnosis and then sent home. What stayed with me during this experience was something my doctor said during my diagnosis, that living with diabetes requires you to become an expert in your own condition. I think that statement summarizes my experience, and I'm sure that of many others perfectly. Learning about diabetes has been a steep and ongoing learning curve. When I was diagnosed, I started with finger prick testing and navigating the uncertainty, complexities and frustrations in trying to understand and predict my own blood glucose levels, which sometimes felt incomprehensible. I've also felt the frustrations of having to self-navigate through the healthcare system, whether that's repeating your story to new clinicians, missing or fragmented medical records, and the lack of general integration of care between different health professionals. However, I've also seen the impact that innovations such as the arrival of continuous glucose monitoring can have on managing my condition, my health, and my day-to-day quality of life. My experience with my condition has shaped my belief that embedding lived experience in research and policy design is essential to achieving the best clinical and quality of life outcomes for those that are impacted by their condition. That belief led me to join Diabetes Australia, where I have had the opportunity to apply my lived experience in measuring the impact of diabetes, and it informs how I define and measure impact, but also how I collect data and conduct research as well. It's also why I'm passionate about our research strategy, which aims to embed lived experience at the heart of research through providing people with diabetes an opportunity to set the research agenda, but also to participate in vital research. So with that being said, let me introduce you to the speakers today. So first, we'll hear from our Director of Research, Professor Grant Brinkworth. And he will present the 2025 to 2030 Diabetes Research Strategy. So Grant is a leader in diabetes and health research with over 25 years experience developing, evaluating and translating evidence-based diet and lifestyle programs and technology-enabled solutions for wide-scale adoption and for the management of chronic conditions, including diabetes. He has worked across academia, government, and industry, driving strategic research portfolios, business outcomes, and collaborative partnerships in Australia and internationally. Grant joined Diabetes Australia in 2024 as our inaugural Director of Research, with a passion for turning research evidence into practical real-world solutions that improve the lives of people living with and at risk of diabetes. We will then be fortunate to hear a response and reflections from Warren Bingham. So Warren is a Diabetes Australia ambassador and a leading research and innovation expert with over 30 years experience in the medical technology sector. Warren is founder and executive chairman of MedTech International, global vice president of ARIA Research, and holds senior leadership roles across Omnis Over and Accent. Warren is a recipient of the MTAA Outstanding Achievement Award. Warren also serves as vice chair of the Medical Technology Association of Australia board. Before I hand over to our speakers today, a quick note on questions. So please send through any questions for me, Warren, or Grant in the QA at any time. We'll collect them and address them as many as we can after Grant's presentation and Warren's reflections as well. So nice to see you all. And Grant, over to you to present the Diabetes Australia research strategy.
Oh, thanks, Michael, and thanks for the nice introduction. And also thank you to all those that are attending today and taking the opportunity to spend some time with us. And hopefully we can provide you with a bit of an overview of our strategy and some of the future planned activities that we have planned. But first and foremost, I think before I get started, I'd like to take a moment to really send enormous thanks to all those who have had a role of getting us collectively to this point. Of particular note, I want to particularly acknowledge our partners, our organisational partners at the ADS and the ADA, who we've closely consulted with through this journey. Other aligned organisations, including Breakthrough T1D, some important members and members of our Diabetes Australia board and executive, and as well as our Lived Experience Advisory Committee and Killing Advisory Councils. And last but not least, I think I want to really acknowledge the many people from the diabetes community, including the people living within at risk of diabetes, their carers, health professionals, researchers, and industry representatives that have all provided feedback through our public consultation process that has contributed and helped shape this strategic approach to ensure that we're developing an approach that's fit for purpose and a strategy that reflects the needs of the community and particularly the people that we serve as the national peak body for people living with a risk of diabetes. It's important to note, to point out that this strategy really builds on our long and very proud history of supporting diabetes researchers within universities and research institutes through our Diabetes Australia research program that was established many years ago to drive advancements in the prevention, treatment and cure of diabetes. So this is a legacy that we're very, very proud of and something that we will maintain. But we are also acknowledging the changing landscape of the health and medical research sector. And it's important that we continue to evolve our approach to ensure that research that we do fund and is conducted remains grounded in strong scientific excellence, but also supports contemporary best research practice in alignment with national and international health and medical research funding agencies, the expectations of our donors, funders and the diabetes community in a way that can fast track research and innovation to deliver impact by activating scientific knowledge into real world solutions that can improve people's lives sooner. So to achieve this, Diabetes Australia's strategy is about taking a transformative approach to research, and this is about empowering community-informed research and innovation to deliver evidence-based solutions that reduce the impact of diabetes on individuals, health systems and society. This approach is really about centralising lived experience throughout the entire research process with a greater focus on translation and commercialisation of evidence-based innovations to support a thriving and competitive diabetes research ecosystem that we can then attract investors and donors to support the important research we need to undertake to ultimately lead to meaningful improvements in the well-being and prosperity of the diabetes community. So for the audience that's attending today, I think it's going to be well accepted by everyone that diabetes is one of the most pressing yet probably under prioritised health challenges facing our nation. But despite the growing burden of diabetes, we have seen funding, unfortunately, including NHMRC funding, which is our primary, which is Australia's largest health and medical research funding body in Australia, that we have seen a decline of diabetes research funding by more than 35% over the last decade. But over this time, I guess we've also seen the research ecosystem evolve, and funding bodies, including philanthropy and government, now demand a more community-informed and consumer participatory research approach that achieves measurable impact and return on investment. So for us, this, I guess, highlights two pivot points. One is how can we actually invest smarter to amplify and achieve more with the funding that we do have available? And two, how do we orientate our research approach to align the expectations and needs of our customers, that being our funders, donors, and most importantly, the people living with risk of diabetes, to ensure that we're unlocking and attracting greater investment into diabetes research? So to achieve this, it's imperative to remain grounded in research excellence. We will always remain grounded in research excellence, but it's also essential that we also demonstrate a commitment to a collaborative, multi-stakeholder and co-designed approach to research that involves meaningful consumer and community involvement. And to ensure that the knowledge that we do generate, the high quality scientific knowledge we generate, is activated to achieve impact through better coordination, collaboration across disciplines and sectors, and that by doing this, we can also address the unmet needs of people living with and at risk of diabetes, the healthcare system, and society. So what does a transformative approach mean? Well, for us, our vision, as I've said before, is to maintain a fundamental focus on research excellence, but alongside this, to prioritise a community-informed approach that centralises lived experience throughout the research process, as well as to support the Australian government's commitment to strengthen the nation's research and development ecosystem by ensuring that research outcomes are translated and commercialised into tangible benefits. So our vision to achieve this is through fostering greater collaboration between academia, industry and other delivery stakeholders, and to increase the technology and commercial readiness of innovations, including basic research, by assisting researchers to validate their ideas, ensuring their viability and practicality for successful implementation into real-world scenarios. And that by doing this, we hope to be able to drive and deliver health, social and economic impact. And that this will require a collaborative action across the research development ecosystem, leveraging partnerships with lived experience, experts, researchers, health professionals, policymakers, industry, and the broader communities. So the aim of the research strategy is really around trying to ensuring that the focus and the coordination of our research investment and efforts directly aligns Diabetes Australia's broader organisational goals and business objectives, which is to deliver a community-informed, evidence-based practical solutions that address the unmet needs of people living with and at risk of diabetes. So to achieve this, we will prioritise research that is going to be strategically aligned with our organisational goals that will be shaped by community-informed priorities and involvement. And so these audacious goals that we have as an organisation include cure diabetes. So that's about advancing discoveries that bring us closer to cure, eliminate complications of diabetes. So this is about addressing the medical and psychosocial complications caused by diabetes, prevent diabetes, which is understanding the causes of diabetes and tackling the related risk factors, enhancing screening and awareness and interventions, including policy that will prevent diabetes, as well as reducing financial burden, which is really about developing solutions that ease the financial impact on individuals and the health system. And that these priorities as audacious goals are also overlaid further with a key focus on addressing the needs of our vulnerable priority populations who are at greater risk of diabetes and related complications, which we are very committed to. So this includes our First Nations people, culturally and linguistically diverse groups, youth, older adults, pregnant women, people living with disability and those in rural or remote regions, as well as people that are facing socioeconomic disadvantage. So to achieve our goal or our aim, the objective of our strategy are really twofold. First and foremost, our primary objective is to activate high quality research that delivers measurable impact for people living with and at risk of diabetes, health systems and society. But to achieve this, we are very well acknowledged that we are not going to achieve this alone, and that we do need a vibrant diabetes research and innovation sector in Australia to help deliver this objective. And so our second core is to play our role to further strengthen the capability, capacity and competitiveness of the diabetes research and innovation sector to achieve research impact in partnership with the diabetes community, including people with lived experience, health professionals, diabetes educators, and other research activation partners, including industry and government. And I think it's through this collective work approach that we will drive the progress and deliver real-world impact. So I just want to sort of talk a little bit about, well, what is Diabetes Australia's role in achieving these objectives? And to achieve these objectives, our vision is really depicted in our social, or our circle of social impact that is centralised around our customer, with a customer-centric approach that focuses on the people we serve and largely fund the research that we've been able, the research funds that we've been able to provide, with a committed approach to improving their lives. This is to ensure that every decision we make, every research dollar we invest, actually delivers value back to the diabetes community and our stakeholders. So our social impact will be delivered through 4 key objectives or activities. It will be through advocating. We have always advocated for research and research funding, and we will continue to champion the role and value of diabetes research and the use of clear, effective communications of outcomes and impact to advocate for research policy and investment that addresses the unmet needs and challenges of the diabetes community. We will actively fundraise, where we want to proactively mobilise resources for increased investment in diabetes research, while actively growing and expanding funding from a variety of sources, including government and academic institutions, industry, public donations and bequests, as well as aligned health agency. So our vision to activate these diverse sources of research funding investment is to also achieve, to ensure that these sources are strongly aligned with our strategic business objectives and priorities. So what does this mean in practice? It means that some of our research funding will be untied and we can be used for open grant calls, whilst others will be used for specific purposes and initiatives in alignment to our organisational priorities that will be tied to specific donor and funder requests. Thirdly, we want to fund research. It is a core aspect of what we've always done, and we remain committed to investing in innovative research across all areas and sectors of research. So this includes basic clinical, health system services and public health research. And this is all required to advance our strategic goals and accelerate breakthrough solutions for the diabetes community. And I'll talk a little bit more later around the diversity of investment approach that we're taking, and how we are going to continue to invest in researchers and innovators, industry partners, and our own research to drive impact. And fourthly, our focus on translation and to translate by empowering people with lived experience of diabetes and engaging with researchers, industry, health leaders and government to collaborate to deliver real-world impact. And by supporting the research sector to navigate translational pathways and facilitating consumer and community involvement in research, we aim to enhance the competitiveness of our research investment so that we can fast-track applications of research to drive impact. So I'm going to spend a little bit of time on this slide because I think it is an important one, because what this does is this reflects or outlines the strategic approach to these research activities that we will deliver the desired value for our customer, which is underpinned really by 6 guiding principles that reflect our commitment. The first is to take a community-informed approach, and that's simply, in simple terms, putting lived experience at the heart of our research strategy that will be driven by the priorities and unmet needs of the diabetes community. So this includes our focus to address the needs and as well as the needs of vulnerable populations who are at risk, who are at greater risk of diabetes and related complications. And it's also about understanding what matters most and the key pain points of people that we serve, so that we are truly addressing the problems with innovative science solutions with a strong value proposition to improve their lives. So to inform these priority topics that will sit under our strategic goals, we have initially synthesised results that are available from previously published white papers and priority setting research evidence. So this includes the Research Matters report that was funded by Diabetes Australia and conducted by the Australian Centre for Behavioural Research that identified important research topics that matter most to Australians living with diabetes. And over time, our goal is to build on this evidence base to ensure meaningful representation of other vulnerable at-risk groups and their needs, so to ensure that they're identified as well through a range of mechanisms and surveillance tools. And what this will do, it will ensure that we're investing into research projects that matter most to those at greatest risk of diabetes and complications. And we feel that this is a responsible approach to ensure that our research funds, which are primarily donated by people living with diabetes, is addressing the things that matter most to them. Our community-informed approach is also about empowering our vision to centralise lived experience throughout the entire research process. So to promote this, we will establish and promote various pathways to activate meaningful consumer and community involvement in the research projects, to foster the co-design, participation, delivery, evaluation, and communication of research studies and innovation. Our second strategic approach is collaboration. Our approach really will be about including or unifying diverse expertise, perspectives and resources across disciplines and sectors to tackle complex challenges for diabetes. By fostering partnerships across research, clinical and health systems, industry, government and community sectors, what we hope to do is to be able to fast track knowledge sharing, translation and innovation. And ultimately, this is really about trying to develop those game-changing innovations that is truly going to come from multidisciplinary cross-sectorial solutions. I think that CGMs that most people, continuous glucose monitors that most people on this call would be very well aware of, have really been game-changing innovations for diabetes. And I think it is a fantastic example of effective cross-sectorial solutions that integrate digital health technology, materials science and manufacturing with healthcare providers, medicine, and people living with diabetes to create an evidence-based solution that is truly making a difference for diabetes management. So I guess as part of our vision, it's how can we play a role to facilitate, to bring researchers together with diverse stakeholders across different disciplines and sectors to create these innovative solutions. Point number 3 is to become outcome and impact orientated. Our approach is to maintain an emphasis on strong scientific excellence. We will never lose that, but it's also to prioritise both early stage and large scale research projects that have clear pathways to practical solutions. I think it's important to note that Diabetes Australia is not an academic institution, and whilst scientific publication will remain a key metric and outcome for us, and it's an important way to disseminate, I guess, knowledge. Our priority is to ensure that our researchers and our investment are delivering both short and long-term goals in working towards delivering tangible solutions that can achieve health, social and economic impact, which is what is ultimately expected of our donors and our funding partners. So a translational focus and mindset across the entire research spectrum, from basic research to population health, is essential to fast track the conversion of scientific discoveries into practical applications that will make a difference. To be brought in funding in our funding. So in response to feedback that we've received through our extensive consultation process, our mission is to support equitable funding of high quality research across all areas of research. So this includes basic, clinical health systems and services and public research, and using a fit for purpose approach to accelerate that progress towards delivering meaningful outcomes. So this will ensure that if we take this approach, we feel that we will be supporting innovative research across all areas of research, and that research projects are addressing the unmet needs of the diabetes community with identified pathways and partners of how that research can reduce the impact of diabetes, whether that be in the short term or in the long-term future. Point number 5 is around researcher growth commitment. So in alignment with our objective to further strengthen the capability, capacity and competitiveness of the diabetes research sector, our approach also includes investing into the next generation of researchers and innovators, strengthening their skills, building capacity and empowering early and mid-career experts to drive the advancements that we need in diabetes research. We do also acknowledge the role of our mentors that support our early career researchers. And so we're looking at models of how we can try and fund a broad spectrum across as much as possible, but it will be a balance of how we can fund all priorities that will be somewhat dependent on our funding sources that we can secure. But we are making a commitment to try and fund as much as we can as possible, with a focus as well as on reducing duplication and administrative costs, so that we can invest as much as we can into research to drive these new innovations. And finally, I think it's important as a strategy to be very transparent. Our commitment is to ensure that we are transparent in our funding management, including clear decision making, the disclosure of our research recipients, the outcomes and impact reporting from the research that we invest into, as well as, most importantly, acknowledging our funding sources through open communication with stakeholders. And I think it's this accountability that's so important for our funders and donors to demonstrate the highest level of integrity is being used as responsible custodians of valuable research funding, and that this research investment is making a difference to the lives of people living with and at risk of diabetes. The delivery of the strategy in our research-enabled social impact agenda and strategic, approach will be underpinned by key research platforms supported by some enablers that will be brought together through our Research Impact Hub. So the Hub is essentially a centralised virtual platform to align, connect and amplify our research activities and resources. So this will include providing streamlined access to funding opportunities, training and engagement tools, fostering collaboration and network across the nation, the national and international research network, and the diabetes community, as well as aligning and amplifying research partnerships and activities to drive innovation and impact. So the research platforms include our research funding programs, our training programs, our platforms to increase community research engagement and involvement, and our research partnership network activities. So we'll spend a few minutes just having a look at these in a little bit more detail. So one of these things that will be most particularly of interest is really our research funding platforms and our research funding programs. So this includes our strategic investment into researchers, innovators, research teams and partners to support groundbreaking projects. So over the next 5 years, we will use these funding mechanisms to invest strategically into research initiatives shaped by the priorities of the diabetes community that are powered by bold ideas and expertise of research innovators. So this includes our project grants and awards that really builds on our long traditional long-running grants program. And through stakeholders' consultation and feedback, what we've been able to do is upgrade this funding mechanism to ensure that we continue to fund pilot and large-scale projects, but with greater equity across basic clinical health systems and public health research that is aligned to Diabetes Australia's strategic goals. This funding scheme will also aim to have an increased focus on projects across all research areas that reflect meaningful consumer and community involvement, and can identify future translational pathways and partners that are required to activate that knowledge post-project to move it from early stage research and testing through to the next stages of innovation. The second funding scheme is our co-funded project grants and awards. So these are our awards that have been co-funded with our aligned health agencies and industry partners. So this mechanism actually allows us to leverage our funding to amplify our effort to support projects that improve diabetes prevention, management and treatment. So our current partners, and many that know that have participated in our grants programs before, we have long-standing partners through the RACGP and the RACP. And recently, our recently announced partnership with Medibank, which will be opening this funding opportunity in the near future. So I encourage everyone to keep their eyes out for this one. And there are always open, and we're always open to new partnership opportunities. So if you're interested in to be a research partner with Diabetes Australia, please do get in contact with us. Our third funding tier is really our PhD scholarship and fellowship opportunities. As with all funding mechanisms, this will be somewhat determined by our funding pipeline that can be secured. But we are pleased to announce that in this funding tier, our Sheila Woodcock Industry PhD program that has been made possible through the generosity of the late Sheila Woodcock, who left Diabetes Australia an incredible gift to support developmental scholarships to advance diabetes research. So to highlight this one specifically, the industry PhD scholarships is really about supporting early career researchers with creative and innovative ideas to address research priorities and real-world needs of the diabetes community. The scholarships will embed emerging researchers within the health system and or health agencies or industry settings to foster cross-collaboration or cross-sectorial collaboration and help researchers to develop solutions to real-world problems and drive research translation and commercialisation. Our partners will also provide co-match funding, which is really important to inject additional investment into diabetes research. And not only that, but to also amplify Sheila's very generous gift and her legacy. So what these scholarships will provide is they will provide eligible PhD students with a generous stipend of a professional support package of up to $60,000 per annum for up to 3 years over the life of a PhD, and to get real-world experience beyond and including the academic setting. So the inaugural Diabetes Australia Sheila Woodcock Industry PhD is in partnership with Western Sydney University, and that will be focused on the economic cost of diabetes. So we're proud to announce that we've identified a candidate has been selected for this one, but additional scholarships will be announced over time, so please stay tuned. And we're also happy to discuss with other institutes, industry partners and health system leaders, other project ideas that might align Diabetes Australia's mission so that we can create other opportunities through this funding mechanism. And finally, our fourth box is really our partnerships or our research alliances. So this is the funding stream where Diabetes Australia will have identified a specific area for targeted research investment, and we'll work with a specific partner and or a research supplier to address this specific business need. So this funding stream is really about fostering strategic collaborations with between Diabetes Australia and research providers across universities, healthcare organisations and industry. So in addition to the provision of research funding, to achieve our transformative approach, we acknowledge the need to go beyond just simply providing research funding, but we also need to invest into research training for both researchers and lived experience experts to support the acquisition of the requisite skills to deliver and achieve the desired research approaches and impacts that we're seeking. So delivered in collaboration with national research and training service providers, our proposed approach is to provide research training programs that will empower both lived experience experts and individuals and researchers by providing them with the educational tools and training modules tailored for diabetes research to build contemporary research and leadership skills, ensuring that we remain competitive in today's changing and meet the needs of today's changing and medical research landscape. So for both researchers and lived experience experts, this will be essentially focused on championing a national program to deliver co-designed community, consumer and community involvement training with the goal to strengthen partnerships between researchers and people with lived experience across the diabetes research sector and all research disciplines. So it's well documented that the effective involvement of consumers and communities, which is expected of today's research grants and funding partners, is actually has shown to improve public trust in research. It facilitates the translation of research findings into practice by making research more responsive to the needs of the community and ultimately leads to more effective and relevant health outcomes. Therefore, given the value and the growing imperative for inclusion of meaningful consumer and community involvement by national funding bodies, this training that we feel we can provide can empower the voices of people with lived experience whilst equipping researchers with the tools to embed lived experience into their work that will be of high value for future research applications, development and research design. For researchers as well, we also hope to be able to complement the scientific skills and excellence, scientific excellence and expertise with additional training that will address some of the identified critical non-academic skill gaps, that is potentially critical for successful modern day research. So this includes skills training around customer discovery and value proposition validations, business model development, research translation, commercialization, project management, and skills around building strategic partnerships. So these are skills that are not always acquired in every instance around through traditional research training and postgraduate degrees. But given its growing importance for successful modern day research, to achieve real world impact, we feel that this is an important, valuable contribution that we can make to the research sector. Another investment into research infrastructure is also to facilitate community researcher engagement through creating and maintaining a national diabetes lived experience researcher portal. So we've previously touched on the importance of embedding lived experience and priorities into every aspect of the research process. However, a key challenge is how do researchers actually identify and engage with research-ready lived experience experts to get involved in research? And on the flip side, how do actually lived experience experts identify appropriate research activities and projects to get involved in? Um, uh, Additionally, a major pain point for research studies and what we often see with some of our funded research projects is that the progress of many research projects, including clinical trials, that are so reliant on the subsequent development and availability of new life-saving treatments, therapies, and interventions, are often hampered by insufficient participation in research studies. So as a solution to this problem, what we hope to do is create, and what we will do is we'll create a national diabetes lived experience researcher portal that will create an accessible pathway for people living with and at risk of diabetes, their families and carers, to engage in research and to stay informed about relevant research findings and opportunities. In other words, our vision is to build a Tinder-like portal that helps connect and match lived experience experts with relevant research activities and projects with involvement guided and supported through our lived experience training. So delivered through our Diabetes Australia Research Hub, the interactive portal will promote Australian-wide research opportunity and trials for participation in all types of research. It will provide consented participant registration to receive communications engaged with tools designed to better connect people with diabetes with relevant research opportunities. It will enable our researchers to register and profile projects to support study recruitment including clinical trials, and offer resources to help researchers connect and embed co-design principles and provide participation with tools to understand and engage in research. And part of our goal is also to drive the creation and delivery of multidisciplinary sectorial solutions that are translated and commercialised for impact. So to elevate our effort as one of the largest non-government funders of diabetes research, our approach is to take a more proactive approach in fostering a collaborative spirit amongst our research-funded alumni, as well as our stakeholders, by creating opportunities for lived experience researchers, institutions, industry, and stakeholders to connect, share knowledge, co-design solutions, and amplify the impact of their work. So we're exploring a variety of platforms and initiatives to achieve this. One way is through our newly established webinar series that will build on today's presentation. Another feature is the establishment of the Australian Diabetes Clinical Trials Network, which we've done in partnership with the Australian Centre for Accelerating Diabetes Innovations. So just to touch on that, this network is really a network comprised of experienced researchers with an established track record in diabetes clinical trials and related fields, and includes early career scientists across Australia, clinical trial coordinators, diabetes nurse and allied health professionals, but most importantly, lived experience representatives. And collectively, the ADCTN review panel will provide feedback on the design of researchers' clinical trial protocols in preparation for ethics and funding applications. And the mission or the vision of this network is to ensure that clinical trials are designed to maximise real-world impact from the outset and provide the opportunity for researchers to increase the competitiveness of their funding applications. So the AGCETN, in short, will provide an avenue for researchers to access and collaborate with clinical trials experts across the field. And we're already actively working and reviewing trials. So if you want to know more about this particular initiative or have a trial protocol that you would like to be reviewed by the committee, it costs nothing. It's a free service that we're providing for the diabetes sector. Please scan this code and you can access the ADCTN network. So as I come towards the end of my presentation, I wanted to specifically highlight the important role of our partnership approach to our research strategy and the partners in bringing people together to collaborate and drive research, innovation and impact. Our strategy success is really is about involving and fostering partnerships and uniting people and organisations across the diabetes community. We already have so many important existing partnerships. So this includes our partner organisations, ADS and ADA, and many of our co-funding partners who are very grateful for their commitment and contribution to diabetes research. But also our research delivery collaborators. So these includes our universities, our institutes and health service providers that support the many researchers that Diabetes Australia fund to advance the prevention, treatment and cure of diabetes. But over the life cycle of this strategy, we are specifically committed to deepening and growing our existing partnerships and calling out for other individuals, institutions and partners that are not currently working with us to connect, contact us to explore potential partnership and collaboration opportunities in our effort to eliminate the impact of diabetes. And finally, I'd like to sincerely thank our generous donors over so many years. They have been so vital in driving the meaningful life-saving research that we've conducted to date, and we're incredibly grateful for their financial support. Our significant investment in research over so many years would not have been possible without the generous support of our members, donors and our co-funding partners. And particularly our bequests that have been so vital to sustain research funding. So we are continuing to be proud to work with donors of major gifts and bequests and their families to ensure that their generous contribution to support diabetes research is honoured in a way that truly reflects their wishes and positively impacts lives. So my last slide is before we hand over to Warren is really to provide a response. It is really about delivering meaningful change for people living with a risk of diabetes, which requires a collaborative ambition and shared action. So we do invite researchers, clinicians, health professionals and diabetes educators, academics and research institutes, policymakers, industry, donors and funders and community partners to join us in advancing and operationalising this strategy. Your collaboration can help unlock new knowledge, accelerate innovation and translate research into real-world outcomes to make a difference in people's lives. So with that, I'll hand it back to Michael.
Thank you for that, Grant. I'll now hand over to Warren to share his reflections. Over to you, Warren.
Thanks, Michael, and thank you, Grant, for that comprehensive presentation. As a medical technologist and someone who's been in the commercialization space of technology for over 30 years, one thing I've come to realize is diabetes doesn't discriminate, having lived with type 2 diabetes for the last 9 years. And just seeing the reduction in research funding over the years is something that's been of a great concern to me. So I just want to acknowledge and just say thank you, and really impressed to see Diabetes Australia getting behind and continuing to get behind research in this particular space. I do have a couple of questions. One, just want to start with perhaps is that some research can take a long time before it actually gets to a point of demonstrating and realizing value and purpose and benefits to the very people living with diabetes. And I'm just interested to know what your thoughts are on that.
Yeah, that's a good point, Warren. I mean, I think it's important to acknowledge that this is very true. Research is a long tail. It doesn't happen overnight, and it's important about building the building blocks. For example, in the context of drug discovery, I think the average is, minimum 10 to 12 years or even longer to make discovery to market benefit. So I don't think we can lose sight of the fact that, that we still require investment into early stage discovery research to create that next pipeline of new therapies and treatments. But I think it's also important to acknowledge the seriousness of this rapidly growing diabetes epidemic. You know, and the imperative need, I think, to how do we do fast track innovation to shorten those timeframes. And this is partly, I think, what our research strategy is about and what it's trying to focus on. Like, for example, focusing on centralising lived experience and fostering investment in alignment with the unmet needs of people living with diabetes. You know, this will make research more responsive to the needs of the community and ultimately lead to more effective and relevant health outcomes, hopefully sooner. By focusing on a more translational mindset, hopefully we can assist research that we fund today to have a clearer pathway of how we move through that innovation cycle, and to also fund research across the technology readiness levels. Warren, I know that you're very across the technology readiness levels as a leader in innovation, but you know, I guess to try and avoid that valley of death. So it's true that we still need investment into early stage discovery research, but we also need a balanced investment portfolio so that we continuing to promote the innovation life cycle so that discoveries that we've invested in yesterday are actually being pushed through to realise that benefit for diabetes sooner.
Yeah, no, I'd agree with you. Thanks for that. I've been having a number of conversations with a variety of people, and some of the comments come up. One in particular, a number of times, talks of the questions with all the research that has been done in the space of diabetes. Why are the rates of diabetes increasing?
That is an interesting one because we have had a lot of investment into research, not just for diabetes, but a lot of health and medical conditions. And you know, worryingly, we're still seeing rates across many diseases continuing to rise. And I think what this suggests and highlights, to me at least, is the complexity of health, complexities of disease and the environment we live in, and that solutions are really not simple necessarily, and that there is still much to understand about the complex diseases, some of these complex diseases, including diabetes. I think that's a really interesting question because I think what it also highlights a lot is what we've been talking about today. I think the need to ensure that we are translating scientific knowledge into real world solutions, including policies that can make a meaningful difference. You know, data that has been collected in Australia, you know, suggests that, you know, in Australia, you know, compared to other OECD countries, we actually do very well in health and medical research in terms of knowledge generation, but we haven't ranked overly well in activating this knowledge into real world solutions. So I think what this really highlights is the need, if we're going to make a meaningful difference in people's lives, to ensure that the research that we are doing, that we have a greater focus on research translation. That includes commercialization to ensure that the research and the knowledge we're generating is activated to ensure that investment is making a difference to people's lives.
Yeah, no, that's a good call. You mentioned earlier early stage research. Is that basic research? Is that the same thing in definition? Because I guess my question is Diabetes Australia still funding basic research as well?
Yes, look, Diabetes Australia certainly will fund basic research. It's a critical part and an essential first stage in the discovery and development of new therapies and treatments. So Diabetes Australia, as it always has, will continue its proud history in funding basic research. But to acknowledge our consultation feedback as well, Warren, you know, Diabetes Australia has been challenged to take a more equitable approach to research funding to ensure that we're funding across all areas of research. So that includes basic clinical health systems, services and public health research, to ensure that we're providing funding across that various stages, as well as providing funding, I guess, across various stages of the innovation pipeline, which is going to be all necessary to ensure that that research knowledge is being translated into real world solutions that will truly make a difference in people's lives. So, thanks for those questions.
Yeah, thank you, Grant. I just want to reiterate, thanks for the support and the ongoing commitment and funding into diabetes research. As I said, for many like us living with it, it's just so imperative and much appreciated. Thanks, Grant. And Michael, I'll hand back to you.
Thank you for that, Warren. We have a few minutes left now, so we can spend some time hearing from all of you and addressing your questions as well. As we mentioned at the start, please feel free to send send through any questions that you have through the chat or QA function, and I can read those out as well. So please feel free to send those through. Give you all a couple of moments to type if you have any questions you'd like to ask.
I guess, Michael, while we're waiting for any questions to come through, I just wanted to sort of further highlight what Warren was saying, is that Diabetes Australia is making a commitment of $40 million into diabetes research over the next 10 years. And so what this strategy is really about is it's really providing a roadmap of how we can maximize that investment and that commitment to diabetes research to truly make a difference for the people we serve. So I think that's one thing that I probably didn't mention, is around that commitment that we made last year to diabetes research. It's a huge investment, and we do hope that that investment can make a true difference. But that investment is only going to make a difference if we work collectively as a unified sector to ensure that we are amplifying our effort towards finding those innovative solutions for people living with diabetes.
Certainly, thank you for that, Grant. And we have a question now from Dr. Ashley Ning. We welcome the research focus embracing consumer involvement. How does this translate with the grant reviewers? Do they understand consumer involvement? How to nuance that to projects, and what is good practice?
Yeah, that's a really good point on that question around. I think that there's probably a need and a requirement to undertake some additional training across the whole sector around what does effective, meaningful consumer involvement look like, and that's for people across the whole ecosystem. So that's a really good point, that in terms of, I think what we're trying to do with one of those program initiatives I mentioned is to provide training around what lived experience means, how to get involved, and how to actually operationalize that. So to that specific question, I think that particular education module will also include people that are a part of our review committee and part of our review, I guess, our review alumni, so that we're ensuring that if we are going to build community involvement into research, that we actually are effectively assessing the involvement of CCI into our research applications and proposals.
Thank you for that, Grant. We've received a couple of people have asked us this question. So how can we find more information about the PhD scholarships?
Yeah, so the website at our hub is the best point. We're just going through at the moment. We're just sort of refreshing some of our web pages, so please bear with us. But I think the easiest way to find out about these opportunities is that they will be released as they become available. And so the easiest way is to, I'll just put that back up, is to stay on our website or to register with us onto our EDM, and then that will ensure that you actually get awareness in real time around these opportunities that come up. So it won't just be the IPHDs, there'll be other opportunities for other research projects and targeted research areas that will become available. So I guess my recommendation, Michael, is for people to register with us, their details, so that they can become part of our database, and so that you're continually informed about new opportunities that become available.
Excellent. And another question. So how does this research strategy differ from or align to research done internationally? For example, in UK, China, and at least until recently, the US?
Yeah, I'd like to think that the research approach that we're taking is a very contemporary research approach that definitely mimics, or not mimics, but definitely is in alignment with a lot of the other international funding sectors and agencies. We've had close discussions with some of the other diabetes organisations that are international, and very much are supportive of the Diabetes Australia approach. Just an example, the American Diabetes Association recently became aware of our new grants format that involves community involvement into research and centralises that, as well as a greater focus on trying to get our researchers to understand, future pathways of translation and the translation partners, and such it was the interest. The ADA invited us to be part of their ADA TV series at this year's international meeting in Chicago. So I think that what this is reflecting is it shows that this approach very much aligns with the shift in the health and medical research landscape, not only nationally, but also internationally. And we hope that by doing this, that this may also help to unlock additional research funding that we might be able to secure through other international agencies.
Excellent. Thank you for that, Grant. I think that's all the questions we've had. And just in the interest of time, we'll look to just cover up on a couple of other things before we wrap up. But if you do have additional questions, please reach out post this seminar as well. So just a couple of housekeeping notes. Firstly, we want to highlight an exciting new opportunity from our industry partner, Novo Nordisk. They are spotlighting early to mid-career female researchers in science and medicine across Australia. We strongly encourage those eligible to apply. It would be wonderful to see some of our outstanding female diabetes researchers recognised for their hard work and achievements. The dates for our next webinar are still being finalised, so please make sure you've registered with us to receive updates. If there's a specific topic you'd like for us to cover, we'd love to hear from you. And if you'd like to use this platform to share, discuss, or profile a topic within the network, please reach out. And that brings us to the end of the session. So finally, again, thank you all for attending today's session. We look forward to seeing you at our next webinar. And thank you all. See you next time.